America healthy again. We're hearing this mantra a lot lately. The MAHA banner covers a wide variety of topics. Some of them are good and some of them are very bad. On the positive side are things like better nutrition, exercise, and diet. Those are all very good things. Unfortunately, the good is being outweighed by the bad and the truly dangerous. A large part of the MAHA movement involves things like misinformation, junk science, funding cuts, and the purge of highly trained experts from things like HHS, CDC, and NIH. MAHA went so far as to fabricate studies that don't exist to support a report that was quite honestly short on facts and long on preconceived political agendas. Part of the MAHA movement has now started to attack doctors as the problem. They're claiming that our healthcare delivery system is the reason for the rise in chronic illness. I'm starting to hear comments like, well, doctors are beholden to big pharma. They're only interested in money. They want to keep us sick to line their pockets. Those comments are becoming all too common amongst the MAHA faithful. These accusations are not only wrong, but they're offensive and dangerous. Now, don't get me wrong. We have a lot of problems with healthcare in this country, and we need to address those problems. However, attacking physicians is not the way to address those problems. In addition, fixing things is going to require the help of physicians. They're part of the answer, not part of the problem. And right now, I sort of feel like that character from the 1976 movie Network, where he throws open the window and screams, "I'm mad as hell and I'm not going to take it anymore." So if you will, allow me to pull out my soapbox and stand firmly upon it for a couple of minutes. To suggest that doctors are profit-motivated, self-serving individuals that would put profits before the needs of their patients, and that they are the reason for the prevalence of chronic illness is not only ludicrous, but it's insulting to every doctor in this country. How did our COVID heroes turn into villains overnight? Remember way back to 2020, when people applauded from apartment building windows as these heroes walked into hospitals, putting their very lives and health on the line for us. Remember the scenes of those doctors and nurses in those horrible suits working long shifts? Remember watching doctors and nurses as they held the hands of their patients because family and visitors weren't allowed in the hospital. You remember that, right? It was only 5 years ago. What happened? How did these dedicated heroes suddenly change their stripes and become profit-seeking, heartless villains sucking at the breast of big pharma? How did that happen? What changed? The answer is they didn't change. They're still the same people they were 5 years ago. The only difference is we now have a secretary of HHS and a whole movement in this country that's more interested in finding somebody to blame for our problems than doing the hard work of finding solutions. MAHA isn't about making us healthy. It's about giving you a villain to hate and blame. Why is autism on the rise? Well, according to MAHA, it's vaccines and Tylenol. Why is diabetes such a problem in this country? Well, obviously, it's because of doctors and big pharma. I even had somebody suggest to me that the reason we don't have a cure for cancer, and I can't make this stuff up, so I'm going to quote them, is because the more cancer, the better, right? Think of all that money for chemo, specialist, etc., with no cure in sight. Just keep managing that cash cow. Seriously. I had to read that 3 or 4 times just to try to wrap my head around it. Look, I recently had a conversation with somebody about the rise in autism, and I was trying to explain to them the difference between correlation and causation. I pointed out that the rise in autism over the last several decades is highly correlated to the increased consumption of avocados in this country. You know what response I got? Is somebody looking into that? You need to make sure people know that. You need to put that on the internet. Seriously. This is how crazy things have gotten. Okay, let's step off the crazy train for just a minute and look at some facts. Yes, America has serious issues with chronic illness. We need to address those issues. Diet, exercise, nutrition, all need to be part of addressing those issues. We lead the world in caloric intake per capita. We have the most sedentary lifestyle in the entire world. We have more people with a drug abuse disorder than any other country in the world. We have more people with a drug problem in this country than China, Russia, the UK, Germany, France, and Canada put together. even though their combined population is 5 times ours. My point is this. A huge part of the healthcare problem in this country and the cost issues that are driven by it are largely self-inflicted. The fact that our life expectancy is almost 80 years is because of physicians in the healthcare delivery system, not despite them. Lord knows we're doing everything we can to kill ourselves at a young age. Here are some facts. The overall cancer survival rate in this country is higher than any other country. Think about that for a minute. Even with patients that often present with comorbidities like obesity, COPD, diabetes, etc., our delivery system is outperforming every other country in the world. When was the last time you heard somebody say, I just got diagnosed with cancer. If only I lived in Canada or Russia, then I would get good care. The MAHA movement isn't about improving public health. It's about telling people who's to blame for our problems. What they're doing is not helpful. It's not helpful to spread misinformation. It's not helpful to attack doctors. It's not helpful to gut our public health agencies and replace them with, and I am being kind here, people with dubious credentials. It's not helpful to end promising research and spend our precious resources trying to find a different answer to a question that has been asked and answered several times. It's also not helpful to cut almost $1 trillion from Medicaid and force many of our poor and disabled to lose access to health care. How is that helpful? How is that making America healthy again? Now, at this point, somebody's going to sit there and say, well, this guy's just biased. You're damn right I'm biased. I'm biased because I have 3 kids. I'm biased because someday I may have grandchildren. I'm biased because I am an intelligent, decent human being. I'm biased because of all those things. You see, I don't want to live in a country where kids get measles again. I don't want to live in a country where we have more people without health insurance than the entire population of Canada, and that's where we're headed. I don't want to live in a country where we attack the very heroes that we turn to in our times of greatest need, like we did during the pandemic. I'm biased for another very significant reason. You see, my oldest son has autism. I've been part of that community for almost 20 years now, and will be part of the community for the rest of my life. I can honestly say that I've met some of the most amazing people because of my son. People who have devoted their lives to helping others. These people share the same devotion and commitment that physicians do. This experience makes me crazy when I hear misinformation about autism and its causes. When RFK Jr. spreads misinformation about vaccines or Tylenol, it's impossible not to respond. First of all, it's not helpful. It doesn't move things forward. In addition, it's mean and cruel. I don't think he understands the natural questions and, quite honestly, misplaced guilt that parents of a child with autism feel. What did we do wrong? What could we have done differently? Why did this happen to our child? Are all things that every parent of a child with autism thinks and feels. Suggesting that autism was caused by us giving our child a vaccine or by the mother taking Tylenol during pregnancy, when multiple studies have proven no causal link, just brings those questions back to the surface. It's mean and it's cruel. Here's what would help. Let's let experts drive the science. Let's let the science look for answers. Don't decide the answers ahead of time and then try to find science to back it up. Spend our resources looking for cures and improvements in care and treatment, not conspiracy theories. Support our doctors and nurses and healthcare workers. Respect them, appreciate them, they deserve it. Yes, invest in nutrition, food security, mental health, and public health initiatives. Don't cut healthcare for the poor and disabled. Simply put, start acting like a decent human being. Start making America the envy of the world and not the butt of a joke. Thank you for allowing me to stand on my soapbox. Thank you for listening. Thank you for demanding better for our doctors. They deserve it. Let's also demand better for our children. Let's demand better for our poor and disabled. We deserve it, but we're not going to get it until we demand it. Thank you.